হচ্ছে যে আমাদের এখন যে আমরা বলতে চাচ্ছি সেটা হচ্ছে পরীক্ষা রিলেটেড, প্রফ রিলেটেড। হ্যাঁ, তো প্রফে অ্যাজ এ সিকোয়েন্স হিস্ট্রি শিট যেভাবে আছে সেভাবে তোমাদের ভাইবা নাও হতে পারে। ফার্স্ট ইম্পর্টেন্ট যে ভাইবাটা হবে, মানে যেভাবে তোমাদের ভাইবাটা হবে, এটার জন্য তোমরা সময় পাবো অনলি 5 মিনিটস। 5 মিনিটসের মধ্যে তোমাদের ভাইবা হয়ে যাবে। ওকে, practical especially. So within this 5 minutes, you have to reproduce your patient, everything. So which thing are very much important? Number one is chief complaint. Number two is medical history. Number three is extra-oral examination. Number four, intra-oral examination related with your diagnosis. Clear? You must have correlate between chief complaint and diagnosis. Okay? Okay. If there is chief complaint that gum bleeding, so the diagnosis should be either gingivitis or periodontitis. There is chief complaint gum bleeding, but diagnosis is carried, then you will get the field mark. Clear? So if there is chief complaint of sensitivity, then diagnosis should be caries or pulpitis, whatever it is. Okay? Attrition, abrasion, or erosion. If chief complaint is bad odor, then diagnosis should be gingivitis or periodontitis. Clear? If chief complaint is tooth mobility, so there will be periodontitis, not gingivitis. Okay, so you must have to correlate with chief complaint and diagnosis, must. Clear? So that is very much important. Then there is important of medical history as a whole. It is important, especially the jaundice. Why jaundice is so much important? Like there is a chance of hepatitis B virus infection, so it could be cross-infected. So you will be a victim of hepatocellular carcinoma or liver cirrhosis. Why hepatitis B virus is very much dangerous? Because it could causes hepatocellular carcinoma or liver cirrhosis. That is very much important. Then prophylaxis for rheumatic fever. Why prophylaxis is important? To prevent the infective endocarditis. Which bacteria is responsible? Streptococcus beta hemolyticus. Okay, group A. Whatever, this bacteria is responsible. Then observation of the anemia, jaundice is very important. I think you know that. So later we will observe. So to check the anemia, you have to first observe the lower palpebral conjunctiva, but you have to check like that way. And you must have to ask the patient to upward the eye, চোখটা কি করে নিতে বলবা এবং নিচে এটা দেখবা, ঠিক আছে? দেন পাম অফ দ্য হ্যান্ড দেখবা, দেন টানের যে ডরসাল সারফেস সেটা দেখবা। ক্লিয়ার? ডরসাল সারফেসে আমরা কি দেখি? হোয়াট উই এক্সামাইন ইন দ্য ডরসাল সারফেস? Depapillation present or not. Which papilla depapillated?
Filiform papilla.
In which condition? Iron deficiency. Okay, if there is depapillated, that is known as bold tongue. Okay, that if there is depapillated, no papilla present, especially the filiform papilla, then we call it's a bold tongue. Okay, or bell tongue. Smooth, shiny in appearance. Okay, then the diagnosis will be iron deficiency anemia. By this way, you have to check the anemia. Then you have to check the upper sclera. Upper sclera means the white portion of the eye. Okay, then you have to ask to check on my hand. Okay, at the same time, floor of the mouth and the palm of the hand you have to check. Clear? Okay, not you must have to check these jaundice in the daylight, then not in this light. Clear? There will be misdiagnosis. Though our light is whitish, I think. So actually you have to check it in daylight, then it will be confusing other than that. Okay, so by this way you have to check the jaundice. Then what type of female history you have to take, like menstrual history, pregnancy history, oral contraceptive pill, menopause is present or not. Okay, why these are very much important? If there is menstrual problem or puberty or pregnancy, then some condition could develop in the gingiva. So my disease, that means the periodontal disease, could relate with the female history. Clear? That's why you must have to correlate it. You have to assure the patient that after that correction, your gingivitis will be corrected. Do you understand? Okay, so don't be too much tense. You have to mention these things. That's why you have to take the history. Clear? Why pregnancy and lactation history is so much important? To
Because
prescribe antibiotics. or any drug, because during
Lactation.
or pregnancy, some drug may causes teratogenic effect or developmental disturbance or some tooth disturbance, like there might be some staining. Which drug may cause
Tetracycline.
clear? Do you understand? Okay, so that's why that is very much important. This is the medical history in short. Your exam will be start by this medical history like that. What is your chief complaint? Okay, my chief complaint is gum bleeding for 6 months or bleeding from gum for 6 months. I think you know that what is chief complaint. Complaint, duration and side duration. Clear? Okay, then external could ask you, is there any medical history, positive medical history? Yes sir, there is hypertension present. So what measure you will take? So there is hypertension, so if there is hypertension is present, then during scaling maybe there is chance of profuse bleeding. Okay, that's why I ask the patient, tell it very simply, I advise the patient to decrease or to lower the pressure. Do you understand? I advise the patient to take the drug, antihypertensive drug, and consult with the consultant or cardiovascular specialist. Clear? You have to mention it like that. Is there any medical history have you got? Yes sir, he has a history of jaundice 6 months ago. So what precaution you will take? Why precaution is necessary? This type of question could come initially. Clear? Then external could ask you, tell me the salient feature, or external could ask you, what have you find in extra-oral examination and intra-oral examination. So could you tell me anybody the salient feature? Anything like there is gingivitis, so what could be the salient feature? Salient feature should be like that, the patient name. How will you mention? Anybody could tell me? Could you tell me? Tell it. What is her name? Do you know her name? So tell the salient feature. বানাও একটা, don't worry, immediately. That is not the salient feature. Salient feature. Just বানাও, instant একটা বানাও, salient feature. Could you tell me? Then so you have to be fluent here. Okay, Mrs. Rimi Akhtar with the age of 22. 22, hailing from Gazipur with the complaint of gum bleeding for 6 months. Okay, hailing from Gazipur. He says Rimi Akhtar, age 22, hailing from Gazipur. Hailing from Gazipur with the complaint of gum bleeding. With the complaint of gum bleeding for 6 months. Okay, on her in salient feature you must have to mention only the positive feature. What you did not get, you should not mention here. Okay, so on intra-oral examination I have found some change in the gingiva, like the interdental papilla, these are swell up and there is redness is present, and on BOP, bleeding on probing examination, I have found present. So there is moderate plaque and calculus, so my diagnosis, it could be a case of plaque induced chronic moderate gingivitis. You have to mention these things. Clear? That is the salient feature. So what is salient feature? You have to mention the name, age, hailing from where, with the complaint of Mrs. Rimi Akhtar, age 22, hailing from Gazipur, and loudly you have to mention hailing from Gazipur with the complaint of gum bleeding for 6 months, and on intra-oral examination, because extra-orally you did not get anything. So on intra-oral examination I have found what you found in gingivitis. Okay, so my diagnosis, it could be a case of plaque-induced chronic moderate gingivitis. In details you have to mention, not gingivitis. So my diagnosis, it could be a gingivitis. What is the case? Sir, it could be a gingivitis. Not like that, you have to mention chronic plaque-induced moderate gingivitis. Clear? Do you understand? Okay, that is the salient feature. Everybody could be asked regarding the salient feature. You have to practice it, otherwise you could not say it. Clear? Then come to the face-to-face problem, that is the gingivitis. What you bring the patient in the frog, that is mostly commonly there will be gingivitis or periodontitis. Okay, so first the gingivitis. In case of gingivitis, if your diagnosis is plaque-induced chronic moderate gingivitis, then external could ask you what you have found in intra-oral. Clear? Then you have to mention the things what you have found. So in case of plaque-induced gingivitis, what are the positive things you could get? Number one, some change in the gingiva and some extra feature could present around the tooth like plaque and calculus. Okay, that is the two feature. So some change in the gingiva. What are the change? Number one, that is redness. Okay, gingiva could be red. Number two, interdental papilla could be swollen fast, not the interpapilla. Initially, the interdental papilla little will become swollen. Okay. Number three, what is the feature? Plaque. No. In case of gingivitis, gingiva, bleeding. So that that term is known as bleeding on probing. So you have to find out the color, redness. Then you have to find out the swell-up, enlargement is present or not. Then you have to examine the bleeding on probing is present or not. Okay. Then there is plaque and calculus. So four things. Number one, redness. Then texture, size and shape. I think you could understand these are just enlarged, so that is not so much important. So number one is redness, present or not. Number two is any shape and size, that means enlargement, present or not. Okay, especially the interdental papilla. Then number three is bleeding on probing. Number four is plaque and calculus. So depending on that, you have to say the diagnosis. So first come to the point. Number one is redness. Could you tell me why in gingivitis there is redness? When you mention I have found redness, you must have to find the redness. If there is no redness is present, you should not mention that gingiva is red. Clear? You have to mention, sir, dear sir, gingiva color is normal, little bit swelling, but on bleeding on probing examination, I have found bleeding on probing is present. So my diagnosis is it could be plaque-induced gingivitis moderate type, though I did not get any redness. Okay, it is not indicated that you diagnosis plaque-induced severe, but there is no redness. What will happen? You don't have to think it. Diagnosis is depend upon the bleeding on probing in case of gingivitis. Clear? Okay, do you understand? Okay, so first come why in gingivitis there is redness. Dilatation of capillaries. That is not the answer.
Engorgement of blood.
No, that is not. Increased blood supply. But why? Due to inflammation. Okay. So in gingivitis there is inflammation, so lot of vascular proliferation and dilatation is present. More blood supply. That's why there is redness. In simple. Okay. That is very simple. Number two, interdental papilla remain usually same. Most of the external they will ask, could you show me is there any swelling is present? That means he or she wants to wants that who either you could find out any swelling is present in the interdental papilla or not. Okay, usually in case of gingivitis, initially the interdental papilla, especially the tip of the interdental papilla becomes swollen. Why the interdental papilla? Actually there is more food accumulation in between two teeth. Okay, and usually patient could not clean the interdental papilla perfectly. So that's why more food accumulated in between two teeth, that's why interdental papilla becomes swell up more. Okay, so in case of gingivitis, what is the type of the swelling? What is the term of the swelling? Why there is edema? Due to accumulation of inflammatory exudates. Okay, how you could understand that it is inflammatory, it is not fibrous? No. In case of inflammatory or edematous swelling, gingiva looks shiny. Okay, if there is edematous or inflammatory exudate accumulation, gingiva looks shiny in appearance. But if it is, what is the other type of fibrous? most common cause of fibrous gingival
Dragging.
then usually the swelling, after swelling the gingiva remain rough and dry. Clear? But in case of inflammatory or due to accumulation of the exudate, actually gingiva looks shiny. Okay? Or whatever. So that is the inflammatory swelling actually present. So from this swelling, external could ask you, could you tell me some localized cause of gingival swelling? Anybody? Localized, just in a specific area there is swelling.
Gingival abscess, periodontal abscess,
Periodontal abscess,
pyogenic
pyogenic neoplasm. You have to mention these four things: gingival abscess, periodontal abscess,
Pyogenic neoplasm.
neoplasm. Clear? Do you understand? Okay. So you have to mention these four things. Okay. So that is the inflammatory swelling and generalized cause of gingival enlargement.
Dragging.
That's all. That's all. Drug induced. You have to mention drug induced. Clear? Nothing after that. That is viva. Okay. So if you mention plaque induced gingivitis, then external could be confused because plaque induced gingivitis could be localized, could be generalized. We could not say directly that in plaque induced gingivitis it is generalized. Clear? So localized, that is due to the gingival abscess, due to gingival periodontal abscess, due to pyogenic adenoma, due to neoplasm. Okay, localized fibroma, lipoma, and generalized cause, that is drug induced. You have to know the name of the drug and their alternative. Clear? Okay, now come to the bleeding on probing. The grading of the bleeding on probing. So what are the grading?
0. Healthy gingival.
Grading is mild,
Moderate.
absent, present, and spontaneous. You have to mention these things.
Yes.
Bleeding on probing, I think that is the grade. Bleeding on probing, grade 1 is absent.
Absent.
How we could examine? Could you tell me how we examine the bleeding on probing?
First, hold in the tip of the periodontal probe at the long axis, parallel to the long axis of the tooth, and then insert it distally with 20 gram of pressure. We have to draw
Insert it distally, why?
in the gingival sulcus.
We must have to mention it. That is so much crucial. We must have to mention it within the gingival sulcus. So tell it again.
So,
Hold the tip of the periodontal probe.
hold the tip of the periodontal probe parallel to the long axis of the tooth, and insert the tip into the gingival sulcus and apply distally. And apply 20 gram pressure. Draw from distal to mesially. If there is no bleeding within the
And wait for 30
Let's say
seconds.
30 seconds. If there is no bleeding within 30 seconds, then bleeding on probing is absent. If bleeding is present within 30 seconds, then bleeding on probing present, and it occurs spontaneously as you probe, then spontaneous.
Okay, that is one criteria. Some external choose linear bleeding, point bleeding, whatever. When this external will come, we'll mention. Okay, then you have to mention these things. Okay, so this is most external like that things. Okay, absent, present, and spontaneous. If there is a spontaneous bleeding, then the diagnosis will be severe gingivitis. If there is present,
Moderate gingival.
moderate gingivitis. Clear? Okay. Diagnosis always depend upon the degree of the bleeding on probing. So from here, external could ask you, how many pressure you will give?
20 gram.
If you give more pressure than 20 gram, what will happen? 20 gram থেকে আমি বেশি প্রেশার দিচ্ছি কি কি রাপচার
জাংশনের ভিতরে রাপচার
তাহলে
ফার্স্ট টাইম ব্লিডিং অন প্রবলেম হবে বাট হচ্ছে
false diagnosis হতে পারে okay false degree চলে আসতে পারে though it is not spontaneous but there could be chance of spontaneous so diagnosis will be plaque in the severe gingivitis but it is not plaque in the severe gingivitis clear okay that is so much important then come to another from this bleeding on probing external could ask you could you tell me the systemic cause of gum bleeding that is so much important could you tell me the systemic cause of gum bleeding you have to mention and thoroughly okay dengue fever in dengue fever why there is bleeding how when there will be gum bleeding how much the level of platelet in the blood when the blood there is gum bleeding.
30,000.
Not 30,000. Below 20,000. Some external choose to say 15,000. So 15 to 20,000. If it is below 15 to 20,000, there will be severe gum bleeding. Clear? Do you understand?
Yes.
In dengue. Why there is gum bleeding in vitamin C deficiency? External could ask you. Tunica media of tunica media of which layer of the blood vessel? Middle layer. Middle layer is formed by some collagen structure. So if there is lack of vitamin C, so the middle layer of the blood vessel of the gingiva will be destroyed, so blood vessel will be thin and fragile. So minor trauma could causes the gum bleeding. Clear? So you have to understand. That will be the viva question. Then plaque and calculus. From plaque and calculus, external could ask you in oral cavity where more plaque and calculus are deposited. Why? Lower lingually, not subgingival answer. Lower lingually. Why lower lingually more?
এখানে
Could you tell me? Why lower lingually more plaque and calculus are accumulated? Most salivary. Most salivary. No, that is there is opening of the salivary
Salivary
gland.
gland.
Most salivary gland, not. There is more salivary duct opening are present there. Okay, so there is more saliva accumulated. Why there is plaque? Is there any
And the minerals in the saliva.
any is there any role of mineral to form the plaque? Why there is more plaque in the lower lingual and upper posterior buccal surface of the second molar?
Lingual tips.
Why there is more plaque due to saliva? There is salivary ductal opening, but why there is more plaque actually formed? Is there any relation of plaque formation due to saliva? Could you tell me? Could you?
Yeah, the ferritic.
No, anywhere. Lower lingually, there is duct opening, so saliva come in. So why there is more plaque?
More polysaccharide is present.
Why? Which polysaccharide?
Music.
Missing. Okay, missing. And is there any other important polysaccharide? Any? Glycoprotein. Okay, in saliva there is glycoprotein. What is the role of the glycoprotein? To form the aqueous pellicle. Okay. In case of plaque formation, there is first stage is formation of the aqueous pellicle. Clear? So to form the aqueous pellicle, saliva is very much important because saliva contain this glycoprotein. So more salivary duct opening, more saliva, more glycoprotein is accumulated, more aqueous pellicle actually formed. So as there is more aqueous pellicle, so there is primary colonizer, secondary bacterial co-aggregation, plaque maturation is happening. So more plaque actually accumulated. Clear? Do you understand? Okay. Okay. Why there is more calculus in lingual? Because from what? Because salivary gland contain minerals. So there is more plaque, but saliva also secrete mineral substance. So mineral also deposited on the more plaque area, so there will be more calculus. Clear? Okay. Now, so from plaque and calculus, number one question external will ask you, in which area there is more plaque and calculus? So in lower anterior segment lingually and upper posterior segment just adjacent to the first and second molar because there is a parotid duct opening. Okay. Why there is more plaque and calculus? Why there is more plaque? Because saliva contain glycoprotein. It helps to form the aqueous pellicle. After that, rest of the thing happen. Okay. Why there is more calculus? Because saliva also secretes minerals. Clear? Without saliva, is there any chance of plaque formation or aqueous pellicle formation? Yeah, food also contains glycoprotein. So if anybody take food, then glycoprotein could be deposited. Okay. Next question, number 2. That is, how many types of plaque and calculus? How could you diagnose the supragingival plaque? Neck type. Okay. And plaque disclosing solution. Could you tell me the plaque disclosing solution then? Fluorescent, that is the light. Erythrocin, that is the chemical substance. Okay. Erythrocin blue. Erythrocin blue is the plaque disclosing solution. Could you anybody tell me how we use the plaque disclosing solution? Why? By how? You have to take the dye. No, you have to take the dye with the cotton. Then you have to apply all over the labial, lingual, buccal surface of the tooth. Okay, it's just a dye. Then you have to ask the patient to wash or gargle. After gargling, the dye will be removed when the plaque is absent. When the plaque is present, the dye will be absorbed by the plaque. So you could see the stain is present in some area of the tooth. Okay, that is indicate that those are the supragingival plaque. Clear? Do you understand? Shall I just how you could understand subgingival plaque and calculus? How? How? Tell me the procedure.
First, you hold the periodontal probe and insert into the sulcus along the long axis, parallel to the long axis of the tooth. Then draw it from
Distal or medial?
in distal. Then draw it distal to medial and then হচ্ছে স্যার daylight না স্যার প্লাক দেখার জন্য হচ্ছে টিপটা দেখতে হবে আর ক্যালকুলাস হলে ওখানে রাফ সারফেস ফিল করবে.
You could feel the roughness in the subgingival area. Okay, then you could understand there is subgingival calculus is present. So by this way you could understand. Okay, is there any subgingival calculus is present or not? Now come how you will examine. Okay, when external asks you, show me where you found. Then you have to come here. External could present here or external could present there. So you must have to hold the position like here. Do you understand? If external right there, then you have to present here. Okay, but most of the time you have to stay in this position. That means 12, 11 o'clock or 10 o'clock. Okay, then when you come first, you must have to put on your gloves first. Not put any gloves here. That is the number one, because you could not put perfectly the gloves here because external is front and so if the gloves is just tear up, then there will be shivering. Clear? So you have to put on the gloves outside, then you have to inside. Clear? You have also to put on mask. So after coming here, you have to observe two things. Number one, light is on or off. Your position is perfect or not. Here, come here, so light is on. Okay. So you have to prepare it. Do you understand? And your position is perfect or not. Then you have to respect the patient. Assalamu alaikum, I'm a student of 3rd year. I am to examine you for the professional exam. Clear? In very short, you have to take the permission, must. Okay? Then